Okay, so this is kind of good, just going to be a whistle-stop tour of some of the work that DHCW is doing to really inculcate user-centered design into what we do and who we are. So I'm going to talk through some of the initial sort of details of what our roadmap includes. And the idea is just to make sure that we're sharing an understanding of what we plan to do at DHCW with regards to user-centered design. So our services, obviously, as you might imagine, cover every demographic across Wales. We have a clear vision and mission around the importance of user-centered design. And so that being said, we do understand we already engage with our users. We do have a long history of um, um, making sure that we're reaching out to the right people in the right way when it comes to designing and building things we do. But we do recognize that a more systematic approach is needed. So in November 2023, a user-centered design working group was pulled together. Rachel Mees, actually, who is, you can see here in the graphic, she's spearheading that with others. And the membership has actually continued to grow. I was about to say I was the newest addition to the user-centered design working group, but already there are people behind me. As I joined the organization at the beginning of this year in the operations directorate as a senior service designer. So our number of practitioners is growing all the time. We've got representatives from across DHCW, so primary care, mental health, clinical operations, as I said, my own directorate, strategy, corporate governance. And there was a lot of effort put into really mapping the current state and designing the future state of user-centered design within DHCW. So we've already begun building a backlog to deliver UCD maturity, i.e. what do we need to get done to become a user-centered design mature organization. So we continue to meet regularly, and we're looking at connections that we can make. So obviously speaking at an event like this is great to really get the word out about what we're doing and make connections. And we're also looking at quick wins that we can deliver on our way to user-centered design maturity. So I'm not going to read in fact, any of this from this slide, other than to say this is a chronologically based look at what our user-centered design roadmap includes. And we've broken it into culture, process and standards, professional development, tools and benefits. So instead, what I'm going to do is I'm going to take you through each of these sections just to sort of dip into what we're doing, what we feel it entails to go from left to right on this slide, from not a very mature user-centered design organization to really well embedded. So firstly, we'll look at culture, raising awareness. So again, presentations like this, getting out there, but also internally, speaking to other directorates and other parts of the business, just to really make it clear that user-centered design is very important for a number of reasons. But also we're here to help those who are interested in bringing it into what they do, facilitate that. So internally, we have something called a 10 talk, happens at 10 a.m., as you might guess, which is, I think it's about half an hour where people can come up and talk about any number of things. And we've had a very successful and highly viewed 10 talk within DHCW. And so we'll continue to do things like that. Collaboration. So learning from other organizations, CDPS is one that I myself work closely with, and my other colleagues do have a relationship with. Obviously, there are consultants in the mix as well. They do have particular expertise, but we're not closed-minded about who we collaborate with. We're also cultivating a pastoral care environment for UCD practitioners. Now, what does that mean? Well, somebody might be put on a project who says, well, what about the user, or what about user-centered design? And sometimes that can be met with resistance. So it's very important to have some sort of pastoral care environment, or even a figurehead that those who are practitioners of user-centered design can really get air cover, support, psychological safety to say what we're doing is the right thing. We're also identifying pilots, exemplars, ambassadors to really ensure that the user's needs are at the forefront of what is being produced. And we're also looking at ways of working to include processes to manage efficient deployment of staff. So actually, I'm working on several projects at the moment, some from Welsh Government, some from other areas of the business, where we've snapped together a user-centered design delivery team, taking user-centered practitioners from across the business. So it's a very exciting, flexible way of working. Another section is processes and standards. So we're creating or looking at creating a user-centered design center of excellence, and we're going to have an intranet site and related content such as our own internal service manuals, guides, and so on. We are always looking or keeping an eye on what the current state of user-centered design plans and systems out there. So whether it's a GDS toolkit or whether it's a pattern or anything out there, we know that a lot of people spent time developing those things. And so again, we're not precious about being able to look out there and look at what other public organizations are doing and really taking forward and supporting the best parts. Embedding UCD into business cases and governance, that's very important, as well as reviewing existing standards just to see where there are gaps within the organization. So we're conducting work to look at that at the moment. Processes are in place to incentivize user research participation. So obviously it can be difficult to do user-centered design if you can't get access to users. So we're looking at how we can best get a pool of relevant and appropriate users for participation in co-design, perhaps even trio writing and other things as well. Matured user research participation pool. So this is sort of feeds into the incentivization. As I said, standards, principles, designs, and patterns. And we're really using a wide range of UCD methodologies, personas, surveys, focus groups, and a lot of agile rituals as well, which was mentioned earlier, and a really important part of our UCD delivery. We're also looking at professional development, This is another element of our maturity roadmap. So skills assessments, just to see who can do what where. Communities of practice, bringing together user-centered design practitioners. We're also looking at DDAT roles and DDAT role profiles. Career grading is an important element of what we do. So you can maybe start as a junior user researcher or junior service designer, junior content designer, and you can see a clear progression, which again, actually does benefit the business if you are able to develop talent. Developing talent through coaching and mentoring, internal and external, learning pathways, whether it's learning resources that we have or selecting external learning and teaching. Apprenticeships, again, getting the young and the next generation of user-centered design practitioners through the door. Assessment of demand and capacity. So we're looking to rationalize our reliance on third parties. Profession pipelines in place, as I was talking, career grading. So professional development is really an important part of the maturity. Tools, this is one of my favorite areas because this is getting into the nitty-gritty of the doing and the designing, especially within my role. So constantly looking at libraries for resources and playbooks, and then we're actually synthesizing those into our own internal resources and playbooks. We're looking at the tools that we have available. My team is the Microsoft 365 Center of Excellence within DHCW. So obviously I will use Microsoft products as much as possible. But again, I do need to be honest and also pragmatic about what are the industry standard tools for service design and user-centered design. So we do use Figma, we do use Miro, our content management systems for our web pages are things like perhaps Miro, but from a design perspective, we are not reliant just on one or two specific tools. We do look and see what the industry is doing. Axelis, we do have an accessibility testing contract in place whereby we can run our products through accessibility testing, and it allows us to move a lot quicker. Data analytics is very important. We are constantly thinking about benefits analysis and how the data that we can provide will help benefits realization understanding. We're also looking at using user-centered design suites and research labs because obviously our internal resources only go so far and we do have limitations. So we're looking at as projects need, to make use of research suites and design labs to really help us with our user insight and inquiry. And we're constantly reviewing all of this. We take an iterative approach to what user-centered design means and how it works for us. So we're investing in the right tools the right way to make sure we're doing the right thing. So the next steps really for us as an organization include, but are not limited to, establishing a user-centered design community of practice, recruitment. I may be hiring soon, and I know other colleagues of mine within DHCW will be hiring roles that support user-centered design within the organization. Planning of professional development for all UCD staff and development of standards. Capability and capacity check, that's happening now so that we can really understand where our gaps are. Repurpose existing roles. This may be contentious. I don't know who's in the audience today, but one of the questions might look like, for example, business analysts versus service designers. Which do we want in a user-centered design world going forward, perhaps? Hiring experienced professionals to bolster capability. That's how I came to join DHCW, and I'm really thankful that I've joined the organization at a very exciting time, and we're doing very exciting work. So I couldn't be happier to add value to what's being done. And again, using pilots, exemplars to pave the way and really embed user-centered design thinking and practices into everything we do. So that was a whistle-stop tour. I hope I'm under time, but diolch, as we say. And are there any questions?
Thank you very much indeed for that, Dan. Do we have any questions there for Dan? How do you ensure user groups are representative and inclusive?
Okay, let me see. All right, just stop sharing there.
Okay.
So the question there was there, how do we ensure user groups, if you repeat that question for me?
Yeah, are representative and inclusive.
So it's very important to make sure that our participants are representative. So for example, on one project that we're working on at the moment, we are actually selecting participants from what is going to be the pilot health board for the product that we're building. So in this case, the health board is POWIS. And so our user research group are going to be a hand-picked selection of POWIS patients. And so what we aim to do is we do look forward. So when we have our discovery phase of our user-centered design agile process, we will be identifying user types. And I did throw out the word personas very quickly in the presentation. Persona design is a key element to ensuring that you get the right participants for testing.
Excellent, thank you. So there's a few acronyms in this one. Fantastic to see the UCD roadmap for DHCW. Is the scope of the UCD COE open to NHS Wales organisations and UCD professionals, please?
Oh, yes, 100%. If I were president, or CEO, should I say, I'm constantly pushing internally that we should be uniting all UCD practitioners, especially within the NHS, under the NHS Wales umbrella. So I think anyone who's worked with DHCW will know that we actually do have already internally good communications channels such as Teams and our SharePoint sites. But yeah, we are always open to working, supporting, guiding and advising any UCD practitioners out there or would-be UCD practitioners.